Hi there, everybody on the Relabelling Reactivity Collective. I've got a really interesting conversation, which I wanted to, obviously it was something that we discussed on the group, and I thought it'd be great to get somebody that is a professional within this industry to give their insight into a very specific and sometimes controversial aspect of dealing with dogs or behavior resolution. I say aspects of behavior resolution, and certainly specifically for reactive dogs. It is my friend and colleague from the FDSA, Fenzi Dog Sport Academy, Sharon Carroll, all the way from sunny Australia, who she's going to explain a little bit about her role. I specifically asked Sharon, actually as a result of a recent post Lemonade conference talk. So we all did. There was myself, Sharon, Denise, and I think that was it, wasn't it? The three of us.
Yeah, Amy was hosting.
Oh yeah, Amy was hosting, and we all were talking about the distinction between arousal and drive, and we were all very much singing, I'd say, from the same song sheet, and it was a great conversation. However, when the conversation stopped, we continued it post the live. And it was really interesting to hear both Sharon and Amy's insight into the behavioral modification and the use of drugs and medicine to help dogs that are struggling with various behavioral issues, and how it can offer another option on the table for dogs that and people that are really struggling with the challenges that can be presented. It's not something that in previous years I was, if I'm being truthful, I was somewhat cynical about the use of meds with behavior resolution, but I've absolutely changed my perspective from my work with young offenders, as a professional dog trainer, I was somewhat cynical about the use of medication and drugs for behavior resolution, but I changed my opinion perspective when I worked with young offenders, excuse me, in my prior vocation as a police officer. And a lot of those kids and those young people were prescribed drugs and to help them through various issues or concerns that they have, specifically with mental health, but all sorts of things like anxiety, depression, and when they had phobias, because that would often block their progress moving forward. And it sort of dawned on me that there's a parallel between helping those people overcome challenges and helping our dogs overcome challenges. So I thought it would be a great conversation to have with Sharon. I'll let you explain a little bit about what you do and a little bit about your background, and then we'll jump into the conversation. So thank you first and foremost. Thank you very much, Sharon. I really do appreciate it.
No, it'd be great. I really also enjoyed that conversation that continued on after the live, which I think went for about as long as the live, and it was great. And yeah, for me, my background is across multiple species. I started with dogs. I think most people that are in the dog world just love dogs as a kid. I trained my dogs as a kid, no doubt now looking back very ineffectively, but I had a great time training my dogs. I did go on to compete, and I was competing in obedience sort of 30 years ago. Then I transitioned to horses because there's only so many weekend days in a week, and you have to kind of choose whether it's dog sports or horse sports, and I went to horses. Spent the next 20, 30 years in horses and went to the top of both eventing and dressage. So went to Grand Prix level, coached through to the Olympic level, so through to Grand Prix level as well. Did a lot of coaching, coached some other nations. And sort of through all of that, I really relied on my understanding of animal behavior, because obviously training horses, just like training dogs, you need to understand animal behavior. During that time, I decided that I really wanted to understand more about animal behavior. So I went off to uni and did all of that part-time while I was still competing and training. I did a bachelor in applied science. Then I went on and did a grad cert and a grad dip in captive vertebrate management, so in the zoo sciences, exotics and wildlife. So lots of protected contact work, lots of cooperative care, lots of positive rewards-based training, yet I was still in the horse and dog world, maybe a little bit of a crossover, became a bit of a crossover trainer, because early on, that wasn't how I started 30 years ago. I don't think it's probably how many people were training dogs.
Yeah.
And so I then went on and did a master's in animal science after that. And at the moment, I'm doing a PhD in veterinary pharmacology. So really looking at anxiety and psychotropic medications for use in all species, but I'm looking at horses mostly, but horses and dogs. Obviously, we pull a lot of information from the human sector because that's where it comes from often. And yeah, so that's my background. I came back to dogs in only recent years and started competing in obedience and rally and trick dogs and a few other things, hopefully soon noseworks and tracking. But yeah, I've only come back to dog competing in the last 3 or 4 years and sort of left the horse part behind. So I have a little bit of a mixed background in terms of training animals, but I did a lot of animal shows and things like that, animal presenting. So lots of different species, but with a real need to understand how they function and why they do what they do. That's why I went and got the academic background to try and back that up.
Excellent, amazing. Yeah. Well, gosh, what a career you've had. Gosh, that's so exciting and so interesting. How diverse.
Yeah.
So obviously there's I'm sure there's a lot of parallels between dog training and horse training and certainly other species training. And just, you obviously have, is it 2 poodles you've got?
Yeah, soon to be 3. Well, we actually have 4. Well, we actually have 3, but one doesn't live with us, lives with our daughter's son. So I trained 3, soon to be 4.
Oh, cool. Oh, exactly. When's the new one arriving?
He's 4 weeks at the moment.
Oh, exciting.
Yeah.
Oh, cool. Okay. So, I mean, really, I mean, obviously, really, certainly the person that would be great to have this conversation with. So there's definitely been a shift in certainly, I'd say it's quite popular in the States, I think, to use meds as a way for, or consider it as an option for behavior resolution. It's not quite so common practice in the UK. I think there's still a culture towards training as opposed to meds as a supporting entity. And just, I think there's definitely a disconnect. What's it like in or so I should say, a misunderstanding. What's it like in Australia then? What is it, quite a popular option or not?
Yeah, we're probably in lots of ways aligned with the US on that sort of thing. I don't know what it's like in the UK, but certainly here we don't have enough behaviour vets or veterinary behaviourists. We have lots of GP vets that are sort of stuck with the situation where people want help with the behaviour stuff. The vet themselves maybe isn't that familiar with it. So we do get, there's certain medications that are the primary medications that are being delivered sort of all over the place because they're the common, well-known medications. Yeah. But I think from the literature I read, we'd probably be pretty in line with the US.
Right. Okay. Oh, that's interesting. So what was your first experience then of actually, looking into, was it your own dogs or was it somebody else's dog? Was it a client's dog? How did that all come about?
Well, for me, it came about through the PhD work, to tell you the truth, more than anything else, because I probably had a very similar view to you, that I really felt like we shouldn't be jumping for medication when it comes to dogs or horses for that matter. And I think probably, especially in the horse world, my main experience of watching people use medications were actually incorrectly used medications. Basically, they were just using sedatives that they happened to have managed to get from the vets for, maybe because they had a farrier coming to put shoes on, or maybe they had a dentist coming and they had sedatives there, and they were using sedatives when they were riding the horse, essentially, because it was the only thing they could access, and that's what they were using. And so I saw lots of things that weren't so great, and so I really just stayed out of it. And certainly in my, I was very much in the sports world of horses, not the pet world of horses, so equivalently to the dogs. And it was, it's a banned substance for competitive horses to use any sort, including things like fluoxetine, like SSRI. So no medications on board for those horses. So it always felt like, well, it's a silly thing to go ahead and use medication because you're not going to be able to use it when you need it. And so I really just stayed quite clear of it until I sort of got going on the PhD work and really went, wow, I think I've been probably a little incorrect here. Firstly, I probably still hadn't really appreciated that animals were so able to struggle with psychopathologies. I mean, I really honestly probably still was a little bit of the mindset that a lot of it was training related, and that we should be just fixing all this with training. And if there was a big problem with the dog, it's because they hadn't been managed correctly or they hadn't been raised correctly. I probably wasn't even being fair in terms of the genetic component at that point. I was still kind of feeling like everything should be fixed through training. And so it wasn't until I really looked into, sort of show me some evidence basically. And I started to go, oh, you can see these things on neuroimaging. Like we can see differences in the brain between an anxious person and a not anxious person. Oh, guess what? You can see that in animals as well. And then you start to go, well, hang on. If there's an actual problem there, a physical, something I can see, then we're probably being unfair to just believe that it's not there. And so that's when I started to go down the road of really looking at what's out there in terms of what do we know about psychopathologies in animals. And I started to realize there's a lot of evidence for all sorts of things, PTSD type disorders, depressive type disorders, equivalent to OCD, so say canine compulsive disorders. Autism is now somewhat being considered by some people. Certainly ADHD-like disorders have been considered in dogs and in some species, panic disorders, phobias. So you start to look at the gamut of things and go, oh, maybe there's some actual problems out there that maybe medication is a fair fit, because we certainly with humans would consider it an appropriate fit. We wouldn't not medicate someone who had an actual condition in humans, so maybe we're being unfair not medicating those animals. So that's when I started to turn around. And then certainly in recent times, yes, I've had a dog that had significant issues that I previously would have just said, oh, this is a sensitive dog, but this was a whole other level of sensitive dog. This was a dog that had depressive-like disorder. Literally, the dog showed no joy for anything, just showed no joy for anything at all. Toys, food, wandered around the house without wagging their tail, just sat around on the corner on their own. Like, you couldn't inspire the dog to be enthusiastic about anything. And this is not a dog that had abuse or anything. This is a dog that had not had a problem. And I went, that's interesting. And yeah, then we used medication on that dog. And I went, wow, that's quite a significant difference. The dog suddenly was happy. The dog suddenly started to enjoy things. The dog wasn't nervous about everything. And I started to go, yeah, okay, I really have to change my ideas here. And then since then, obviously, I work as a behaviour consultant. So I see lots of dogs that have been medicated. And now I'm someone who I wouldn't consider myself someone who jumps to medication and thinks medication is the answer in all cases. I certainly don't. I think there's lots of times that we need to look to the management, we need to look to the training, we need to look to the home environment, need to look to lots of things that can be changed, not just medication. But I do think that factoring medication in now is something that I quite comfortably consider.
Well, it's interesting you say that, because certainly, so the conversation post the discussion that we had after the Lemonade conference was really interesting. And I think that there was a couple of aha moments that I personally had, and on changing my perspective on meds as in for behavior or behavior resolution. The first one is understanding that we've essentially manufactured these animals that we have in our home. This is not a natural process that your dog looks like, has that coat type, has that behavior trait. That is not a natural that hasn't happened naturally or organically. It's been manufactured. And as a byproduct, you are relying on somebody's subjective interpretation and opinion of what should be a desirable trait. So if we take this conversation really, this is amplified, I would say, is within the sports world. Sports horses and sports dogs are notoriously weird, is the long and short of it. They are notoriously, they have neurotic behaviors, they have neurosis, they have obsessive compulsive, they have extreme responses, they have apprehension, all that stuff, because the misconception, and this is the conversation which originally started, which is what is drive versus arousal. The misconception is that the dog that is excited is driven, when actually the dog is probably anxious or stressed. So what then happens from a breeding point of view is we select two parents that have that appearance of, oh, he's really driven and excited. You put them together and we have then a whole litter of puppies that have these behavioral traits. And it's the spectrum of behavioral traits. So fear is very closely related to, the fear and aggression are related. So apprehension and fear again are related, and so forth. They're sort of all interlinked. So what then happens is, if you have a dog that is slightly nervous, put to a bitch that's slightly nervous, they're going to have a load of nervous puppies, and that's therefore that trait is then magnified and so forth.
Mm-hmm.
Plus, you then have the environmental influences, you have the training, etc. Before you know it, a trait that can, in the right situation with a really skilled trainer, could be harnessed. You have with somebody that doesn't tick all those specific boxes, becomes a massive problem. This is so prevalent within certainly sports bred dogs. If you look at like Malinois is a great example of a very extreme breed of dog. Whenever I have anybody ask me about Malinois, should I get one? And I always say to them, the first year is not about training the dog, it's about survival. And I mean, that sounds dramatic, but it really is. The issue is not teaching the dog to want to work. The work that will come within the dog. It's teaching the dog not to react to the postman, to settle in the house, to have an off button, to have the ability to not react to everything that moves, to not be hyper vigilant, to not live literally in a constant state of arousal, because that's what Malinois are, because the misconception is that more is better. So I think that, as human beings need to take some responsibility with the fact that we've created these, versions of dogs, whereas probably if they were left to their own devices, half of these dogs would probably die out, because they'd be so hyper vigilant, they'd be no use to, social and the community, as it were. There'd be no, the hyper vigilant, hyper aroused, really edgy dog would be constantly having that effect on everybody else. There would be no purpose to them being, welcomed into the gene pool, should we say. So they would get weeded out. You would create dogs that had that a much more balanced, and obviously there'd be loads of factors involved. It's the same, I'd say, with sports horses. Sports horses are notoriously, the great ones are notoriously extreme. Like a bag, a leaf falls and the horse will be like 6 foot up in the air, hysterical, hyper, which then makes them what you would call more expressive, and their movements are more dynamic. The fallout is you have to then live with that animal. I mean, a lot of them are, I'm not saying a lot of them, that's unfair. It's not uncommon for those horses to be boxed up primarily, come out work.
A lot of them.
Yeah, because it's a safety issue. You can't have if that horse was out in the field and a leaf falls and it goes hysterical and it bolts through a fence, that's a liability. So, it's, and you think of that from a horse that responds so dramatically to a leaf falling is a problem. That is not a normal response. By all means, it's a fear-based animal or a flight animal. It should look at it and go, what's that thing? And then it should carry about it should have a
return to normal.
Exactly. But and I think as well, there's so many, you could go on this tangent. Those dogs, as I say, like the obsessive compulsive dogs, when for training, the often it's about repetition, drilling. And that's a very traditional approach to dog training. Well, if you have a dog that relishes repeating, that dog again is going to be more successful with that methodology. They're going to be used at stud or bred from, and then that trait is going to be exacerbated and so forth and so forth. So before you know it, several generations down, you have dogs that they make great sports dog, but really struggle with day-to-day life. And that to me is a huge moral and ethical issue that we need to be addressing, because, first and foremost, our dogs, if you have a great sports dog, my boxer is a great example. He's a sports dog. I bought him with the intention of doing sports. He has been plagued with injuries, and he's ended up not being able to do the sport that I intended him to. He's a great family pet, partially because of the way he's been reared, but partially because his genetics are not extreme. And boxers, because they haven't been a really a popular sports, certainly for IGP, they're not like the Malinois. He can actually be a really great house dog. He's really chill, he's relaxed, he's never been neurotic about things. And you think, actually, if the fact that he couldn't have his sports career, and yet he can be a great family pet, with even despite the way I think he would have always been that type of dog, and a lot of his siblings actually never did sport, says a lot about that type of dog. Whereas if my Belgian, my Malinois, if she couldn't do a sport, I would be seriously in problems, because the first year with her was absolutely, like, I mean, it was, you know,
Yeah.
I have to say, and this isn't um it never concerned me because I knew I would, it wasn't I've had
Yeah.
several Malinois, I knew this is what they
Yeah.
do. But like, she was so extreme, like her biting alone, like her responses to things was like, you know, it wasn't just like,
Yeah.
oh, there's a person. It would be, there's a person, I must be hysterical, I must bite them. And you think, if you know, if you didn't understand that breed of dog or
Yeah.
that type of dog, so it's interesting that we both had that mindset shift from, no, 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 it's all training, it's all management, you know, it's how. And I think there's, as you beautifully said, um, that's absolutely still the case. There is a place that the dog needs to be trained, needs to be, have its needs met, it needs to have, you know, stimulation physically, mentally, etc. But once you've done that all, and actually you ask yourself the question of, actually, is there something else going on? That's where I would say looking to and consulting with a qualified veterinary behaviorist is going to be something that is worth considering.
Yeah, yeah, definitely. And I mean, we had that discussion, and I mean, you've just summed it up there. I mean, we are not looking at dogs that would necessarily survive in the wild. These are not dogs that have their evolution hasn't been natural. In fact, if we look at street dogs around the world, if you go to places where we have domesticated dogs, but completely street dogs, they haven't had a home for the last several generations in terms of living with people in a home setting. Those dogs, they don't do the chaotic stuff. They don't, you know, they don't tackle each other. It doesn't look like an off-leash dog park. They don't run at each other. They greet each other in much more normal, polite, calmer ways. And their whole way of being is much calmer because it's necessary in order to survive in the wild or, you know, in the streets. It's necessary to not be hypervigilant.
Yeah.
If you're so over aroused by every little thing that happens around the place, you're going to mentally exhaust yourself, and you're not a good fit in terms of an evolutionary fitness to go on and pass those genes on. Absolutely. You need to be able to identify relevant cues, things that matter. Another dog sort of giving you indications that they're going to that they're not happy with you being there. You need to notice people that are chasing you down the street to get rid of you. You need to notice those relevant cues. You need to notice relevant cues like food and things like that. But you don't need to just notice everything in the environment. There's lots of things you've got to habituate to. Things that are just never going to matter to you, and they have to not matter to you, otherwise you're mentally exhausted. Whereas we manage these dogs, we put them in crates, or we do all these exercise programs with them, or you know, or we put them on medication, or because we're having to manage. And look, some of these dogs are on medication and then being bred on. And I'm not saying that if they're on medication they shouldn't be, but I'm saying so you're not even necessarily, when you go and look at that parent dog, really seeing that parent dog in its raw genetic form. So it may already have been influenced by other things. And then, yeah, we breed on with these. But I'd say I mean, that's a big problem in the sports dog world and in the sports horse world, where we're breeding for them to be incredibly sensitive to cues, because we want them to be very sensitive to, in the case of horse, to our leg aids, to our seat aids. We need them to be very sensitive. In the dog world, we need them to just listen for every little cue. We need them to see every movement of that dick or every cue from the handler. So they have to be sensitized to looking for cues. Well, as you get a more sensitized animal to cues, it's also more sensitized to every cue, not just the cues you want it to be sensitized to.
And the other,
so that's the problem.
And the other note on that is, what is creating the sensitivity? Is it a physical issue? So, for example, there was a very, very well-known line of German Shepherds that were incredibly, you know, prominent in the sports world. And it was because their bites were very dynamic. They'd have a really full, hard, crushing bite. And particularly, there was a consistency within a couple of aspects where the dog had to take off from the ground, and a long flight. So the dog would have to take off. And as it happened, after several generations, the dogs start to consistently break down all around the same age. And when people come out the wash is that they all had a very distinct back problem, lower back problem. And if you think of it logically, as they took off, there'd be that pain reflex, and as they bite, the pain would be removed because the dog would be caught and be lowered, as it were. So what would happen is that would be misinterpreted as, oh, this full, dynamic, intense bite. Actually, it was a pain response. Several generations later, that problem would be exacerbated or come out more prominently, and the dog started to break down. It was only when people the dogs start to break, that they start to look into it. Another a very, very popular agility and obedience sire, he produces consistent, or that line produces consistently, again, very, very hyper flexible backs, because they make great sports dogs, agility dogs. They've got that flexibility, they can run and turn at speed. The fallout is several generations when you get dogs that have to have lower back operations and paralyzed because of it, because the trade-off is, the misconception is, the flexibility is a desirable trait, let's breed on from it.
Let's go extreme.
Yeah, and the flexibility is not created by, it's a physical thing within the dog, and more isn't necessarily better, as it were.
Better.
Yeah.
And I mean, that's true when we push any behavioral trait or morphological trait. When we just push it, it becomes abnormal. And in the truest sense, as in actually functionally abnormal, something that's not sustainable, whether it's a behavioral trait in terms of a physical behavioral trait, or whether it's a mental trait, it becomes not sustainable. And I would say, like, we're talking sports animals there, but in the pet dog world, we see bigger issues than we used to as well. And a lot of people want to have that discussion all the time. Why is there more aggression? It feels like there's more aggression in dogs than there used to be, or aggression's a big one mainly, but separation anxieties and things as well. But aggression's the one that people go, they're the one that if someone wants to have a battle with you about training styles, that's the first thing they'll go down, is like, well, it's all this soft training that's caused this. It's all this, treats only and not giving the dog enough discipline. That's what's created this whole explosion of dogs that have all these behavioural issues, and that have all these anxiety issues, or have aggression. And I would say, stop and look for a moment. What's actually happened? What else has changed in that last few decades? One, the dogs are living in the house 24/7, much more of the time than ever before. Now, whether that's okay for the dog, whether it's natural, that's all irrelevant. The bigger problem is that means a lot more interaction with the people. So what used to happen when I was a kid was, kids came home from school, they might have gone in the backyard and played with the dog for half an hour, but then they come inside and do their homework or watch TV. Dog was left in peace. The dog only had to tolerate being annoyed for half an hour a day. They could put up with that. But now the kids come home and they have to put up with them from the moment they come home to the moment they go to bed. And so you've got a different, in the end, the dogs go, you know what, I can't take this any longer, and they have an explosion, or they become anxious, and you get all these other issues. So you've got changes in lifestyle, but even beyond all of that, the genetics have changed purely through selection, because quite frankly, when I was a kid, if a dog growled at the kid, or if a dog got out of the place and attacked the dog next door, all of those things, at point blank, it was just honestly what happened. It was, the dog was euthanized. Now, the problem, I don't have a problem with the fact that those dogs aren't now. What I have a problem is that they were taken out of the gene pool because of that. And so now they're not taken out of the gene pool. So you've got these dogs breeding on.
Absolutely. And the other thing I'd add to that is, I don't know that, I think, I lived in Australia for in the late 80s, and it was the same thing. There's definitely been a cultural shift between dog ownership and the relationship we had with dogs. So what used to happen when in late 80s, even prior to that, is people just used to let their dogs out the front, let the house, and they'd come back in the evening. So what would happen is you'd let your bitch out, it might be in season, she'd come back by the dog down the road, they'd have a litter of puppies. Oh God, what am I going to do with these puppies? Oh, my neighbors will have them. So there would be a very distinct type that would live within that area. And there would be that are somewhat like a social commonality between those dogs. They would look the same.
They understood each other.
Absolutely. That would be one aspect. And the other thing is that we obviously, there's been I think, and my perception is, there's a cultural shift in the relationship we have with dogs. Dogs are no longer dogs that live in the house and in the garden, and you fed them scraps off your plate. They are now extended members of your family. So we want them to sleep in our beds. We want to do selfies with them, and those things. I've got no issues with that, but we have to also understand, like you said, there's that interaction, but it's quite intrusive interaction. Like, it was very, generally speaking, you only took the dog to the vet if it really, really needed to. It wouldn't be taken to the vet, or like, there was no physios, there was no chiropractors, there was no osteopaths. There was no all those things, all that intrusive, intensive. There was no hydrotherapy. Hydrotherapy was taking the stick and throwing it in the water at the local pond. That was hydrotherapy. So our relationship with dogs has evolved, and it's much, much more, like you say, it's much more intrusive. It's much more intertwined, and therefore, if you collated data, time of interaction a day, say, for example, in 2021 versus 1960, I suspect would be night and day. The other thing is dogs were very much, they were there for a purpose. That the dog largely had a job. It was either, a working dog, or if it was a companion, it would be a ratting dog, etc. You generally didn't have purebred dogs. You had these, almost modified Heinz 57 that lived within a community. The father of your dog would be the dog down the road or up the, down here, and they'd be within the locale. You wouldn't get the weird. And if you had the weird and wonderful, an unusual dog, probably people would be so like almost a little bit reluctant to sort of so that dog would be left in
separated.
Yeah, they wouldn't be the little scruffy mongrel, etc., etc. And I absolutely think that then the fallout of that is there's more awareness, or the issues with dogs. And certainly in the UK, we had the Dangerous Dog Act in the 1991, where it was publicized massively about these demon pit bull dogs that were out there savaging women and children at a daily rate, and it was so popularized. It created within people this fear culture, and you still to this day, there's that underlying fear of, if my dog behaves inappropriately, is certainly with dogs that are reactive, that they're going to be seized, they're going to be in a kennel, they're going to be put to sleep, and all that ensues in people's head. And I think that then creates, again, another layer of anxiety, and it's so forth and so forth, isn't it, really?
Yeah, and I think, exactly what you're saying too, with, the local dog would just mate with the local dog, but by virtue of the fact that the dogs with probably, and, any psychological issues, let's say, those dogs had already been weeded out. They weren't roaming the streets mating with other dogs.
Yeah.
And so they were pretty much very, what we tend to say, stable. They were very stable dogs that roamed the streets. And so again, it's trying to work out exactly what's changed, because sometimes we would reflect on the fact that, because leash laws have gotten tougher, the dogs don't get enough exposure to other dogs to learn social skills. We could go down that road of saying that. Yeah. Or we could equally say, well, guess what? The dogs we have right now, we couldn't, I tell you right now, in this area, if everybody just opened their gates and let their dogs out, it wouldn't be pretty. And it's not because they haven't, it's not necessarily just because they haven't had that exposure, but the gene pool is very different of the dogs that we have now. And so because the generation gap is so short for dogs, we've changed what we expect of them far quicker than they could evolve to keep up with it, like far quicker. And so we're expecting extreme things from dogs that are not really even in a position to give it in some cases. And then, all of those things. But then on top of that, with the sports dog stuff we're talking about, let's not forget that when we want that brilliance and we want that that sensitivity, even in human athletes and people at the top of their game, whether it's being, superstar CEOs around the world or people going to the Olympics, they're a little bit different to the general population. There's an anxiety component usually, because anxiety and performance are kind of closely linked. You have to need to want to get to the end result. You have to have a drive to perform, and you have to be concerned that if you don't perform correctly, there's a consequence, whether it's an intrinsic consequence or whether it's an extrinsic consequence. You have to feel all of that to put the effort in, to perform, to put the work in. And so realistically, when we look at those superstar sports dogs, we would see that also in superstar human athletes. That little bit of edge, that little bit of extreme performance anxiety, essentially.
Absolutely. And the again, OCD is a classic trait that you see in high performance athletes and dogs, in the sense of, and successful business people.
And anxiety disorders, generalized anxiety disorders.
Absolutely. That need. There's a really interesting documentary that's been released by called The Me You See. It's with Prince Harry and Oprah Winfrey, which they look at numerous people from different walks of life that all have mental health issues, and there's an Olympic boxer that she has OCD. So and she's compulsively cleans, and if she gets, you know, really it's really like sad and limiting in her life. But I mean, she's an Olympic, I think she was a medalist. But it's the parallels between the two things, how, you know, the boxing so almost helps with that OCD because it's something that she can control. So there's that constant parallel between the two. It talks about there was another person that's again a high profile, I can't remember what they did, but something again similar sort of thing where they had that obsessive and anxiety, or the highs and lows of success versus, you know, something when they, you know, with that peak of their game, and then when they were off, when they were building up to an event, how it was all the high, and then after that they would hit a low depression. And it's absolutely the pattern that happens. And I think that you see so many similarities certainly in the sports dog world, and, you know, dogs that I would say in, again, we're talking about traditional training versus modern training or reinforcement-based dog training. I think that the reason why I would say dogs, certainly in the UK, were much more stable is because what would effectively happen is if those, again, we would have, when you compulsively train, what would normally happen, the dog would probably become defensive or aggressive or resort to that quicker. So if you did, for example, an ear pinch retrieve, that dog's going to say no, in which case you would write off the dog, and the dog would be, again, taken out of jail. It would be a bad.
That's right.
Yeah. So exactly. Then that trait would be, so what you would create is a dog that was incredibly biddable, that would tolerate and endure pain as on aversives within the training. So in actual fact, what you end up creating is a really, really, you know, a somewhat biddable, pliable dog that didn't really want to think for itself, but was happy to go along with what you asked it to, which was in a lot of ways was a great dog to train. I think, but then what's happened is we've then taken that baseline and we've just amplified it and extreme, and again that whole thing, and more isn't always better, and we've ended with a lot of sports dogs and domestic dogs that are a product of our misunderstanding and shortcomings in being subjective about what a good dog should be. It should be able to walk down the high street and not want to react to the traffic. And I'm not saying there is training and there is management and there is obviously breed characteristics. Your border collie is going to be motion sensitive. Of course it is. Yeah. We've got to give and take a little bit. You know, we're talking, even that is surpassing, you know, hundreds and hundreds of years of genetics, you know, where we've selected, you know, wolves that, you know, or our relationship with dogs, where we've selected traits, that predatory the predatory sequence,
motor sequence,
absolutely, we've modified it. But to then further do that, we've ended up creating almost, you know, some really, really mixed up dogs. And I think, you know, and when you talk about, you know, that's coming back full circle to the talk about medication. We've made a rod for our own back, and we need to take ownership, I'd say, as an industry, to go, you know what, we've kind of messed this up. We need to help them in other ways beyond training and management, etc. And here is an option that just might, you know, get this dog and make this dog more function, so it can at least function in this environment and this world and this chaotic system, and be truthful to say, if the dog is having to be medicated to live a functional, normal life, I agree. Whilst it might not take it out of the gene pool, it's something you really need to consider if you want to exaggerate this, or, you know, pass this responsibility onto other people that might not have that skill set, and that might not have that experience, that might not have that understanding, etc.
Yeah. And I think, you know, I guess where to draw the line with the medication aspect is, how do we know when we should be using medication and when we shouldn't? And I mean, that's just a mess of, you know, what's the actual home situation for that dog? How bad is this affecting this dog? Those types of things. Because, you know, for me, if I look at a dog that's responding in an extremely, in an extreme way. So say we have a reactive dog and the response to the trigger is extreme, like significantly extreme. That's something I go, you know what, we probably need to maybe think about getting medication on board if that's going to help. If the underlying reason for the reactivity, if it's going to be helped by medication. Another time would be if the dog escalates incredibly rapidly. So we've got a dog that it goes from 0 to 110 too fast for people to recognize that something's going on. I mean, obviously some of that comes down to training for the human, so they can be observant enough to notice the small cues. But I promise you, there's some dogs that are quicker than others. And some of them give lots and lots of small cues that the people are missing, but some of them don't give a lot of those small cues. And so I would say if they're escalating rapidly, too rapidly for the person to manage, that would be another time. If the dog's true quality of life is affected. So if we have a dog that has the people literally can't take the dog out of the home for fear of what's going to happen, or the dog is so fearful, for example, in a fear case where the dog's just hiding in the cupboard the whole time, or the dog literally has spent time with the owners, for a significant period of time and is still barely warm to the owners and the normal routine of the house. Those sort of things, extreme noise sensitivity, phobias, big separation anxiety issues, those sort of things, or times when we've implemented behaviour modification, but we've quite quickly plateaued. So we saw some really good response initially, and then guess what? There's been no improvement. We're getting nowhere. They're still triggering at the same distance, at the same intensity. We're not making inroads. That's another time I go, maybe we should be thinking. And the other thing is, I guess where it gets messy is how much do we factor in the home life or the capabilities or the skill level or the time commitment of the person. I don't think we should turn around and say, well, just because the person has no time for the dog and the dog is not going to get any enrichment and it's not going to get any training, well, we should medicate. However, there is a point at which you say, well, even if the environment the dog's living in is not perfect, if we can't change that, maybe we still have to be fair to the dog. So even if that dog in another home environment wouldn't need medication, maybe we still should consider it. And you would agree, I'm sure from your background, that say, for example, a young offender that's in a correctional institute, that's not a great home environment. They may need medication to cope with that home environment that they don't need when they get out of that home environment. So maybe that same individual, if they're in a different setting, wouldn't need it. But we have to take the home into account, that dog's home. We can't always give them a perfect home. And it's no use saying, well, because the people aren't making enough effort, we're not going to medicate the dog. I think that's not a good choice for the dog.
You know what? That's such a great point. In that, I think that comes back to, I would say, and I'll be truthful, that was my take on it, as somewhat of a judgmental perspective on dog ownership. So, well, you took this dog on, it was your decision. Well, why don't you make the commitment, and why don't you do that? Because life is what it is. People aren't full-time dog trainers. They are learning their craft. Their timing's not going to be great. They're not going to understand to read the dog definitively. All that stuff considered. But you know what? They love that dog. And if anything went wrong, they would do whatever it took to help the dog. They're trying their absolute damnedest, but you know what? Their skill set isn't up to par. Let's give them a lifeline, a temporary lifeline, just to help them through until they, because that spectrum of, the time span of, or the timeline of them acquiring the skills to be able to help the dog might not be moving at the same rate. The dog's
fast enough.
Exactly. And you go, they might be behind the 8 ball. That's fine. And the thing to say, which I think you said really, really articulately, it's not, meds is not the first option. Let's do behavior modification. Let's create a training journal. Let's get some data. Let's upskill ourselves. Let's give this dog exercise. Let's look into enrichment. Okay, we've done all that. The dog makes a sudden improvement. And then, like you say, we just can't get over that next run of the ladder to move the dog forward. And that's where, okay, do you know what? I think we need to give ourselves a bit of a breathing space so we can think, okay, how, let's consider, and the word is consider, and talk to a professional about the option of meds in behavior resolution. Such a powerful thing that you said there, Sharon. I'm really glad that you put it that way. And again, as I said, I've done a whole 180 on this, because I was very much I was very judgmental. I would support, if you can't put the work in, why did you? And then you go, well, what's the other option? So we're going to just keep passing these dogs on to people.
That's right.
So now we've got a dog on the 4th or 5th home. Okay. So, and unless you can find.
We're not helping the dog by doing that.
Or what's the other? Put the dog to sleep. Okay. So that's there is a middle ground. I'm not, there is instances where rehoming the dog is definitely an option. putting the dog to sleep is definitely an option.
Yeah,
But you know
absolutely.
what? Giving the dog meds is absolutely an option. And that's the thing. It's all about options. Let's have the full conversation, free of judgment, free of pointing fingers, and let's see if we can. The primary concern is let's help the dog. Let's help the dog. That's the biggest thing.
Yeah.
So,
Yeah.
so just give people some of the the medications and their effects. So the obviously with reactivity, anxiety is a huge one. And what can people do, or what can be considered to help anxious dogs?
Okay. Yeah, I think it does come down to working out what is causing the issue. And in many cases, there's anxiety underlying the issue. And if there's anxiety underlying the issue, there's lots of options. So I guess the main thing at that point is to consider maybe one of the longer term medications. So, you have to know up front, that means that maybe you're going to have to medicate every day. You may be going to be doing that for 6 or 12 months, and then maybe longer, but potentially being able to taper at some point after that, and looking at the effect after you've added the medication and put in the work. Because in fairness, at that point, the idea is not to medicate, then go, wow, my dog looks great, I'll just do nothing. The idea is to medicate, to buy yourself time to get that training done, so the dog is slightly less reactive, or gives you more signals that the dog's not comfortable. So often you're going to end up with a long-term medication. So one of the most common things would be an antidepressant, a human antidepressant. Maybe an SSRI, so that would be something like fluoxetine or sertraline or paroxetine. Maybe
SSRI is
selective serotonin reuptake inhibitor. So what it does essentially is, what usually happens in the brain is that area, that synapse between the neurons, the presynaptic neuron will actually take back the serotonin that isn't instantly attached to the postsynaptic neuron. So what we do instead is, by blocking that reuptake, is we're saturating that area with serotonin, basically. So it's just making, and serotonin is a happy drug, it's a happy neurotransmitter, essentially. So we're aiming to change the dog's mood and emotion by sort of flooding the area with serotonin. And so they would be the most common medications that you're going to come across. So some of the brand names are probably very different there, but Prozac, most people would recognize, or Zoloft, those type of things. So that would be, but you have to recognize that that's going to be a long-term medication. It's going to take often 4 to 6 weeks to take effect. Now, to take full effect. Now, sometimes in that very early phase, you'll see the dog being a little bit more lethargic, being a little bit sleepier, maybe going off their food. The general sort of rule is, if the dog, as long as the dog basically looks well during that period, and as long as the dog isn't malnourished to start with, is just to push on and at least try and get to that 1 month mark, because most of the time those side effects have disappeared by that point. But certainly talk with your vet during that time at all if you feel uncomfortable. But most vets are going to tell you that. So they would be, that's sort of one option, is those human antidepressants that are used as anxiolytics. Now, we can use situational meds, or I mean, there are other antidepressants that are used, like, say, a tricyclic antidepressant, which is things like clomipramine. So Clomicalm, I think, is the brand name in quite a lot of places. Amitriptyline is another one of those. They are, those tricyclics are a little bit older in terms of generationally to the SSRIs. They were sort of a first line for human treatment until the SSRIs came out, and then they're sort of replaced for the most part, purely because they have their therapeutic index for the SSRIs, which just means basically the time between, or the space between therapeutic dose and a dose that's going to potentially be toxic, is huge in SSRIs. So for humans, for example, literally people have taken, tried to overdose essentially and taken 100 times the dose, and they go into hospital, they're like literally have a bit of a headache and a bit shaky, they send them back out within 4 hours. They're very, very safe from that perspective, whereas the TCAs are not as safe. That window is much, much smaller, and the side effect profile is quite different. So the SSRIs tend to be considered much safer, less side effects, and they're usually the choice. But on saying that, the tricyclics are still used quite frequently, and they're very effective. And in some cases, they're the drug of choice because they have a different side effect profile. But yeah, then going on from there, you're going to be more often than not looking at situational medication. So that would be more when the dog has maybe a noise phobia and you know there's a thunderstorm coming, or you know there's going to be fireworks. So you give the dog something. Most of the time that is going to have a sedative effect. So it might be a benzodiazepine. And that would be to literally just calm the dog entirely for the next little while so that they don't feel the need. And it's an anti-anxiety. It's not just a sedative. So it just makes the dog still feel more relaxed and calm, as well as physically calming the dog. So they would be, your two primary things would be either a longer term drug or those shorter term drugs. Now there are other things that are used and that are considered, and that tends to be if the underlying reason isn't just anxiety. So if there's potentially a straight arousal issue and things like that, because remembering that the anti-anxiety medications are only really effective if the underlying reason is anxiety. So their aim is to change the emotion and the mood of the dog. Whereas if we use say alpha-2 adrenergic receptors, which are like a sedative, or even some of the beta blockers, what it actually does is it makes the whole system not be able to physiologically over-arouse. Now, for humans, it's actually been proven that in some cases that's actually quite good for anti-anxiety as well, because what happens is you see something that's quite scary, or you put yourself in an uncomfortable position, your heart starts to race, the blood pressure changes, the respiration rate starts to change, you start to sweat, all these things happen, your mouth goes dry. Now, if you can stop all those physiological things from happening, sometimes you actually feel better purely because that response isn't happening. And so even though they act to just dull the whole system essentially and stop you from being able to, from an autonomic sort of nervous system perspective, stops that sympathetic nervous system from really getting ground. It can't activate to a crazy level. They don't directly target the brain's, they're not directly targeting emotion and mood. They're really just trying to get the whole system to just slow down. They're not specific to, they're just basically hit many target organs. So they're the other things that sometimes you'll find will be used. Then beyond that, there's lots of other things like trazodone and gabapentin and things like that you will see used. Ironically, the scientific studies on those, they don't really come up crash hot. They look a little inconclusive, shall we say, in dogs. However, from a practical perspective, when you talk to people, it's amazing how many people have phenomenal success using those types of drugs. And certainly something like trazodone, it can be used as a situational, or it can be used long term, because it has two completely different modes of action. So one is when it's being used short term, just the situational, and one is when it's being used long term. And often it's put in there maybe on top of an SSRI, so you've already got this daily dosing happening, but then you have a little bit of a booster if you need it for a specific situation. Often that's something that's layered in on top, and in those sort of cases, and gabapentin as well is another one like that. Totally different class of drug, but that's used in a similar way, where you can get quite good effect in a fairly short space of time. So when we start with those, if we have a dog that's having really significant issues, sometimes you're going to get both to start with anyway, because you're going to need that long-term drug, but you almost can't wait for it to take effect. So you'll be using a situational while it's taking effect. I guess the thing we all get most frustrated about with using medication in the dogs is how long it does take. And then sometimes the change is a little subtle. And so then you're trying to work out, is it working, is it not? Is it a dose issue? You might find that your vet tries changing the dose a little bit, but then they may go, you know what, let's try a different medication. I would say at that point, don't lose heart. I think a lot of people get really frustrated and think it's drug or no drug. So they sort of try a drug and they go, well, drugs don't work. And well, that one drug didn't work. Maybe another drug will, or maybe a combination of drugs will work. So you've got to give it time to try some different options and to and for it to take effect. And then the other problem with those behavioural meds, those longer term ones, is the aim is not to see a difference in the dog day in, day out. So you really shouldn't see a dog that looks flat or lethargic or unable to train. You should look at a dog that still looks great and happy and able to work and able to run fast. They should look very similar. Well, that in itself sometimes makes people think it's not working, because you don't actually see necessarily the big triggers every day. So you're waiting until the time when you see a big trigger to know whether you've had any change, and that can be an issue too. And then I guess the other thing to consider for people to remember too is sometimes if you've had a dog that's very anxious, that's a dog that goes to behavioural activity with its anxiety, so it paces and pants, it's always on the go, it never settles down. When you give that dog medication, sometimes they become more like a typical dog. And that can be a shock if you're not familiar with what a typical dog looks like. So suddenly you think your dog has been sedated. You go, no, my dog's tired. It's laying around all the time. There's something wrong, but it's actually normal. It's just you're not used to that normal, and you're not used to that dog looking normal.
Yeah. And it's really interesting you say about, as I said, I talk back to my previous profession. So working with kids that had schizophrenia and bipolar, which were, the resolution is long-term meds with both those mental health issues. And it was sometimes a little bit of a trial and error process to find the dosage that worked for them at that time. And, again, often, it took several months and a lot of time. And I think, like you say, you've got to be prepared to ride it out. The key thing you said is that you need to be, first and foremost, if you are going to consider using meds as an aid, is to find a veterinary behaviourist that is willing to work with you and be committed to the process and the time it may take to work out what's best for your dog. So there is always a trade-off. So the trade-off might be that the time might take, you've got to be patient. It's not like everything, even behavior management and resolution from a training, it's going to take time. You've got to be committed. It could be costly. That's the other thing to consider. So that's the other thing, the consideration. So it isn't just as simple as going, like, there we go, I pop the pill and voila, that's it, my problem is solved. You've got to be committed to the process. You've got to be invested both potentially time-wise, emotionally, and potentially financially to the overall game, which is to have a dog that is happy and well adjusted and can live its best life. And I think that's the really the thing that I wanted to get across. Everybody that I would say, or certainly myself and Sharon and many like us, our greatest concern is to give our dogs the best life. So we follow a principle of training that is compassionate to the dog and takes the dog's feelings and emotions into consideration. And the same and that isn't applicable just in the sports terms, that is applicable to any environment. And it's worth considering if our dogs are living their best life, and if they're not, what we can do to help them, including exercise, training, stimulation, enrichment, and also possibly behavior meds if appropriate. But again, just to be really clear, this is not a conversation about everybody go out there and get your dogs on pills and they're going to stay. It's to say this is another part of the conversation that I wanted to have with someone like Sharon, to really open it up and just open and change. Because as I said, I was very cynical. I was absolutely anti. I was very judgmental. I was reluctant about any meds, etc. And I've been fortunate that I haven't had to use meds for behavior resolution, but I've certainly had to use it for pain management. And that's another thing that could be going on. Your dog could be in a level of pain. We would think, if for example, I've had dogs with arthritis, I'd think nothing of using medication to give them their best life so they could live, their fullest life. It would be not even a moment's hesitation to put my dog on long-term Metacam so that it can live its best life. But then when I had this mental block about behavior modification, you go, well, if the dog isn't happy and if the dog isn't living its best life, then surely if I can do something to help it, why not consider it?
Yeah. And I think the other big change that's happened is how much we still were very much thinking of it as a last line of defense, like, with the try everything else until you proven everything has failed. Now, I agree we should be trying everything else. We should get in and start and try everything else, but we don't do the try it until we've given up and the only option left is medication. In fact, nowadays, quite often, it's considered something that we need to think about quite early in the piece, before the dog has developed lots of habits that we don't want, before the dog has developed more fear and anxiety about situations because we've kept exposing it to those situations without the help of medication. And so if we think it's something that might require medication, it's not a matter of waiting until we just believe there's no other choice. It is a matter of considering it during the process, or the early process, when we see those particularly extreme cases, or when we see something that has plateaued quite quickly, or especially when there's significant fear and anxiety. And I think coming back to really assessing what's causing it, I mean, some simple things are remembering that reactivity, I mean, you'd see this, you know this, when we talk about reactivity, sometimes people are saying, my dog's really, really reactive. When you're looking at a dog that's going, yeah, I really want to chase that squirrel. You know, yes, that dog might be lunging and barking and leaping at the end of the leash. That is not a dog that has a fear and anxiety issue. It may look exactly the same. And so it's easy enough when we see them wanting to chase, you know, a small animal, but the same can be true of bicycles, joggers, cars. Some dogs are chasing that thing because they got quite scared when that jogger came up behind them and they're leaping out because of that. But some of them are just going, wow, a jogger, that looks like fun. I'll just chase after the jogger. And so we really have to realize that in those cases, an anti-anxiety medication is going to have very little effect on helping you because it's coming from a different place. You may get some effect because you get a little bit of the dulling of that need to respond so quickly, but you won't get, you know, so you're still having to get someone in there, get, you know, a behavior consultant, get a dog trainer, get someone in there to really assess what's going on. And then when you go to your vet, you know, giving them lots of information, getting, you know, like you say, pain ruled out as a possible cause. But then I would say beyond that, listen to your vet, listen to your veterinary behaviourist you've gone to, and whatever that medication they think is appropriate for your dog, that's the one you start on. And then you go to the next one. Don't just listen to this and say, but Sharon said, no, Sharon didn't say that one's better than the other because I don't know your dog. The same as, you know, don't get on Facebook and ask how other people went with that medication because, you know, your dog is not their dog. Go to someone who you trust. You go to a veterinary behaviourist that's qualified that you trust and listen to what they're saying for your dog and your situation because it's probably very different to the dog that's on Facebook.
Absolutely. I mean, that's a great place to end and really a huge thing, a disclaimer to say. This conversation is about bringing it to your awareness. Sharon is not saying this is a yes or a no. You really need to seek the help of a professional and do the homework. And again, it's just a consideration. Sharon, this has been a fantastic conversation. I'm sure we could keep nattering, but I'm just mindful of the time.
No, we would.
Thank you very much for your time. Really super insightful. If people have enjoyed the conversation, I'm sure I can twist Sharon's arm to do a follow-up.
Absolutely.
Just put some feedback. But Sharon, absolutely brilliant. Fantastic. So insightful and so knowledgeable. Thank you very much and see you soon.
Yep. See ya. Bye.